Hi, everyone. Thank you for having me. I hope you can hear me well. So I'm just going to go straight into my presentation. I actually have more than 7 slides, but I'm going to go fast. I won't take up more than 7 minutes. So this is me coming from the National Healthcare Group in Singapore, and we are carrying some reflections on the identifying the needs for a smarter future. A bit about Singapore. We'll start. We have a population of about 5.64 million, but as you can see, only 3.5 million are citizens, and the rest are the permanent residents or non-residents. And within national, in the space, in the healthcare landscape of Singapore, there are 3 public health clusters, of which National Healthcare Group is one of them. And we take care of 1.6 million to 2 million residents within Singapore. So National Healthcare Group takes care of one of the largest population in Singapore. There are 2 healthcare trends that I thought we should mention here in order to sort of give you an idea of what are the priorities for smart nursing or digitalization in nursing. One thing that we're moving heavily towards, even though we're a small country and very dense, was to look at the idea of hospital to home, hospital at home. As our elderly population reach a certain threshold, our hospitals are not coping. So in order to make sure that we can continue to provide care, we got to stratify our patients and then accelerate movement towards hospital care. What you see in this report is 2021. In fact, our government has just announced in 2024, April onwards, the hospital at home care model is going to be mainstream. And so it's going to be a standard thing in Singapore healthcare going forward. The other thing that does have a bearing on our work is the fact that why Singapore is positioned in the Global Burden of Disease study. So it was a 2001 study that shows that Singapore has one of the best longest life expectancy in the world. I think we are top 3. But yet, when you look at the disease burden that we have, Singaporeans or Singapore residents live their last 10 years of their life with certain amount of disability. And that's definitely not desirable in our view. While our people are living longer, in fact, one of the longest in the world, we're not living well in the last 10 years. And so then these are the top causes of the year of living with disabilities. And looking at these the top causes of this in Singapore, we do know that nurses can play a bigger role in these research areas, whether it's in the form of depression, anxiety, or even diseases associated with musculoskeletal conditions. And in National Healthcare Group, we've decided to focus on these 5 areas. As you can see, mobility, frailty, and falls, multi-mobility, mental health are all top of our concerns. And of course, infectious disease, because we hold the largest infectious disease center in Singapore. A bit of a nursing profile in National Healthcare Group. We have altogether 10,000 nurses, if you include our ancillary support staff, which we call the HCAs, the healthcare assistants. So 10,000 in National Healthcare Group. For the whole of Singapore, we have about 45,000 nurses, of which 10,000 are found in Singapore. Now a bit more into smart nursing. We have within National Healthcare Group identified 4 areas for innovation. One is on smart nursing and smart sensing, anticipating care with early intervention, empowering patients, activating patients and family to keep track and maintain their health status, enabling decision-making in real time. There's a bit of cut out there. Empowering care anytime, anywhere, so that we don't need experts all the time by making data available, information available. And one of the things that we thought is pretty important is we need to continue to find technologies that liberate nurses for job redesign, because they're really burdened with a lot of physical care, and that doesn't help for a certain age profile of our nurses. Here I have some examples of explorations that we have under the 4 categories that you just saw. So in other smart sensing, intelligent sensing, we have a fall prediction tool we call Presage with robotic response. And then we are looking at early detection of at-risk conditions through predictive sensing. We have a wound care application under empowering patients. We were experimenting with Google Glass in enabling decision making in real time, putting decision support algorithm through Google Glass, making it easy for people to gain access to such decisions. But it didn't work out that well, but that was some of the exploration. Liberating nurses for job redesign is really about, while we talk about gadgets and all, we also want to look at process redesign, innovation along process innovation to remove burdensome work or manual work. RPA, robotic process automation, something that we can convert manual work to robotic automation. And then some form of training in metaverse. One of our questions that we always ask ourselves is, with so many explorations in mind, how do we divide and conquer? Do we do it across all our institutions within the National Healthcare Group cluster, or we form multi-institution teams to explore them? And then we have to look at some of the low versus mid and versus high hanging fruits, because looking at big technology take a while. We do need some transitional technology or process innovation to enable people to work smarter. So an example of intelligent sensing is what we are doing now is we have moved away from, for false management, move away from contact sensing for false management to which is some of the market solutions available. We want to move away from contact sensing to anticipative management for false non-contact sensing. So pretty much like what Prof. Jia showed earlier, something that's non-wearable, contactless sensors that you put in the system. But instead of an LTE technology, we use video analytics with thermal sensing so that we can have some privacy for the patients being monitored. Through video analytics, we are able to anticipate when the patient who has at risk of fall is attempting to get out of bed, and with that, initiate some early response from the nurses. But we didn't want to have a system where we are dependent on the nurses' availability to respond. So now we are really looking at possibility of having a more reliable responder in the form of a patient assessment and communication robot. But there is a lot of thoughts are still being put in place. Unfortunately, we couldn't find a good form factor to develop the robot. But though there enough work being done in these areas for now. But moving forward, then when we look at the advancement of video analytics, we are also thinking if we do it in home deployment, we wanted to even enable it to do early detection. Through behavioral monitoring and behavioral insights, whether it's their nocturnal behavior, the sleep-wake cycles, the sleep duration, the toileting frequency, gait patterns, the number of steps, how far they can walk within the house. We're hoping to get some sensing, some reliability in predicting some early signs in terms of whether it's dementia, whether it's frailty. Then we can seek early help for these residents at home. So again, is to use their daily movement, their daily behaviors to predict early signs and symptoms of a particular illnesses, like frailty or even dementia. One example of a decision-making tool in real time is a wound analytics that we are hoping to develop. And we hope to integrate decision support via AI, both for the staff and for the patient, for the staff to use, as well as for the patient to empower them so that they know when to seek early support, early help if their wound is not progressing well. Finally, just to end off with some slides on second slide on challenges. Sorry, I know there's some announcements in the background. Hope it doesn't disturb you too much. While looking at some of this innovation, we do have to overcome challenges associated with data security and privacy, since it concerns patient data. budget constraints, of course, change management in terms of resistance to new technology and workflows. Every new technology does come with workflows. A fast evolving technology, when taking too long to work on something, by the time you finish working it out, it may be already been outdated. And all sorts of regulatory compliance that we have to contend with. Finally, while we talk about some of the top-down innovation solutions that we're looking at, we also want to support a ground-up innovation to harness innovation potential, as well as harness the interest of investors to continue to build a curiosity mindset. So in one example that we saw here was one of our staff noticed that it's quite cumbersome to refer to a workflow algorithm for nasogastric tube feeding, and then had to do manual calculations on her own. So she decided to use ChatGPT to develop a programming code. And then the file is now available to auto-calculate an aspirate amount and reflect the value of our decision support value as predetermined by her institutional protocol. Something fairly easy can be developed by someone at our front end. We're now thinking of how to encourage such innovations and mainstream them with the support of institutional infrastructure. And so that's why it's now nursing leadership's headache to scale it across NHG. So while we're looking at some large-scale innovation, we are hoping to also encourage ground-up innovation. With that, thank you very much and for your attention, and thank you for this opportunity to be here today.